Okay, then I think we stop near tetracyclines, right? We stop near tetracyclines. We will discuss tetracyclines. Okay, tetracyclines. Okay, so I think we discussed linezolid, right? We finished the linezolid. Now we will discuss some antibiotics and their side effects, right? Some antibiotics and their side effects, right? First, we'll discuss tetracyclines because we'll start with tetracyclines. It's my favorite, right? So, what is the most common side effect of tetracyclines is photosensitivity. Remember, photosensitivity, and sometimes you can also land up in acute renal failure except doxycycline. So doxycycline has a safe renal profile. Okay, it has a safe profile regarding renal system. And one more thing is tetracyclines, they block the bone growth. Why? Because they bind to calcium, because they have a calcium binding property. They also cause esophagitis, inflammation of esophagus, and they also cause yellowing of teeth. Yellowing of, that is discoloration of the teeth. Tetracyclines cause discoloration, yellowing of teeth. This is an MCQ previously 2021, I think, Neet PG, right? And one more important side effect is vestibular toxicity. Just give it a triple star mark. Vestibular toxicity. Okay, mostly minocycline. This has the high vestibular toxicity. And tetracyclines are contraindicated in pregnancy. Why? Because it has a teratogenic effects, as well as it's contraindicated in children until or unless the safety profile outweighs the risk, along with, and it's also contraindicated when it's prescribed along with autocoids. It should not be prescribed along with autocoids. Remember, it should not be prescribed along with autocoids. Okay, autocoids, sorry, not autocoids, antacids. Sorry, it should not be prescribed along with antacids. Why antacids? Why it should not be given along with antacids? Because it causes something, a side effect called esophagitis. So it should not be given along with antacids, right? Okay, so the next antibiotic with the higher side effects, aminoglycosides. What is the most common side effect of aminoglycosides? I will talk later, but nephrotoxicity is the side effect mainly we see, and the most common is ototoxicity. And why it is dangerous? Because it is irreversible. Aminoglycosides cause irreversible ototoxic damage, right? Then if you come to the side effects, auditory side effects are mostly due to amikacin, seen in case of amikacin. Auditory side effects are mostly caused due to amikacin, aminoglycoside. Then vestibular side effects are due to streptomycin. So streptomycin drug causes vestibular side effects, and they also cause neuromuscular toxicity. And aminoglycosides are contraindicated in pregnancy. Okay, now we come to another drug called erythromycin. Erythromycin belongs to which class? Macrolides, family macrolides. Now erythromycin causes something called motilin receptor stimulation. Erythromycin causes motilin receptor stimulation, due to which the patient may land up into hypertrophic pyloric stenosis as well as diarrhea. So motilin receptor stimulation is being exerted by erythromycin, due to which the patient may have complaints of diarrhea. And it also causes skeletal muscle weakness, and mostly it also causes QT prolongation. Erythromycin causes QT prolongation. and also it causes cholestatic jaundice. Right, these are the side effects of erythromycin. Now we finished about erythromycin. Then the next class, which is very important and has one of the serious side effects, that is fluoroquinolones. If you take fluoroquinolones, they also have the side effect photosensitivity and QT prolongation. Erythromycin has, and even fluoroquinolones also have QT prolongation. They cause rash on the patient, as well as they induce seizures. As well, they cause some side effects which can be asked as a MCQ, and in fact it is already asked as an MCQ previously in 2019 I think so. It causes, fluoroquinolones cause tendinitis or tendon rupture. They can also cause tendon rupture or tendinitis, right? Now the fluoroquinolones risk is mostly seen in elders. Okay, in elderly people who has renal failure and has a history of steroid use. Elderly people who are having a renal failure as well as a history of steroid use, fluoroquinolones are very dangerous. Then we come linezolid. Linezolid's one of the most dangerous side effect is bone marrow suppression. Very important MCQ, please note it down. And linezolid also induces MAO inhibition, right? And it also causes mitochondrial toxicity. Very important, guys, this one, mitochondrial toxicity. I think previously 2018 we have a question on MCQ on it, and it lands up into optic neuritis. It causes optic neuritis, then lactic acidosis, whatnot. Linezolid has some serious side effects, acidosis. Okay, now let's discuss about beta lactams. Beta lactams, they cause one serious illness called pseudomembranous enterocolitis. Right, now which drugs mostly cause? In beta lactams, third gen cephalosporins cause this condition more prominently than amoxicillin. Amoxicillin also cause, but cephalosporins, mainly third generation cephalosporins, most commonly cause pseudomembranous enterocolitis more prominently than amoxicillin. And beta lactams also cause something called hypersensitivity. Okay, now we come to cefperazone. It doesn't have much side effects, simply it causes some sort of rash, diarrhea. Okay, next we got talk with I think we finished beta lactams, we finished linezolid, and what all we have? Cefamondole. We are just talking about cephalosporins. We should talk about cefamondole for sure. Cefamondole, it causes not a most common thing, but still it's a problematic thing, hypoprothrombinemia. It causes hypoprothrombinemia. It can be a potential MCQ this year 2024 Neet PG. Next, imipenem. These drugs cause seizures. They land up in seizures. Sulfonamides have some serious side effects called kernicterus. What is meant by kernicterus? Can anyone? Increased bilirubin levels increased bilirubin levels in the body that has spread to the brain, or also can be defined as CNS, increased bilirubin levels that is spread to the brain or CNS. So sulfonamides cause kernicterus after birth, and it also causes one important side effect called acute intermittent porphyrias, and also it causes methemoglobinemia. Okay, so I think sulfonamides, this sulfonamides causing kernicterus as well as acute intermittent porphyrias, these two things you should remember. And cefamondole causing hypothrombinemia is very important. It can be MCQ this year. Okay, and they also cause rash. I think these things not much important, and they also cause bone marrow suppressions. Yes, this might be a clinical question, MCQ, so just look on it. And they also cause one phenomena called crystalluria. Okay, crystalluria, right? Okay, I think this is enough as per antibiotics are concerned. These side effects are enough. Okay, now we will discuss as per about antivirals. Okay, so first we will discuss, right, some of the anti-herpes drugs, their uses as drug of choice as well as their side effects. Guys, this table is very important. Probable MCQ may come, so you just make it a 3-star. Okay, what is the first anti-herpes drug that we will be discussing? Most commonly used, oral valacyclovir. It's the drug of choice in herpes simplex virus or varicella zoster virus. Okay, and oral acyclovir. See, these are two isoforms, acyclovir and valacyclovir. These are two isoforms, right? Then topical acyclovir. Okay, so these three drugs are used as drug of choice in herpes simplex virus or varicella zoster virus. But if you ask me, in these three drugs, which is the most superior one? Oral valacyclovir is the superior. Oral valacyclovir is the superior one. It should be your first choice if it is present in the option. If it is not there, then you can go for oral acyclovir. Okay, or you might also have topical acyclovir, but your first option should always be oral valacyclovir. It is the first choice and it is the superior one rather than oral or topical acyclovir. Now if you come to side effects, what is the most common side effect that you see? Crystalluria. It's the side effect caused by acyclovirs, val or acyclovirs. Now if you come to IV acyclovir, they cause herpes simplex virus encephalitis. Okay, and they also cause the same side effect, that is crystalluria. Now oral valganciclovir causes cytomegalovirus, but we have another drug, that is oral ganiciclovir. But oral valganciclovir is more potent, or you can say that oral valganciclovir should be your first choice. If it is in the options, you tick oral valganciclovir. That is superior than Remember, in a simple statement, oral valganciclovir is superior than oral ganciclovir. Okay, remember this. Okay, so anyhow, these two drugs, they can be used as drug of choice in CMV, cytomegalovirus infection. Now you take one more, that is IV ganciclovir, IV intravenous form of ganciclovir. For which condition we use? We use in CMV, cytomegalovirus, with high risk of blindness. If there is a cytomegalovirus and there is a higher chances that a patient may land up to the complication of blindness, then we should give IV ganciclovir. Means rather than oral, you should convert it into IV ganciclovir. You should give IV through intravenous form. But what are the complications of ganciclovir? It can be oral, it can be IV. The main and most dangerous complication is bone marrow suppression. Bone marrow suppression, most dangerous complication, right? Now, foscarnet, it's a drug of choice in resistant herpes. Drug of choice in resistant herpes. Okay, and it doesn't have that much big or that much serious side effects, but still it might land up into electrolyte disturbances or abnormalities. It may land up into electrolyte abnormalities. Now, pseudofovir, guys, this drug can be an MCQ this year, so please check pseudofovir also. It is generally used as a DOC, drug of choice for recurrent laryngeal papillomatosis. Very, very important MCQ. Pseudofovir is used for recurrent laryngeal papillomatosis, and also it is also used for the infections of BK virus, also for the infection of adenovirus. Pseudofovir is also used as drug of choice for adenovirus. Now we will discuss about some influenza drugs, anti-influenza drugs. I think in 2019 Neet PG we got an MCQ on influenza drugs. Okay, so please pay attention to it. The first one is oseltamivir, oral oseltamivir, which is used in influenza A strain and B, A form and B form, and it can be also be used for bird flu infection. Now the second thing is inhalational zanamivir, right? Inhalational zanamivir is exclusively used in oseltamivir resistant cases. Now this one can be a potential MCQ. You might be given a clinical question where the patient had a history of resistance for oseltamivir. So what is your most probable drug that you will keep or prescribe for this patient? It is inhalational zanamivir, which can be used in oseltamivir resistant cases. Now, what is their mechanism of action? It's okay up to the uses, but what is their mechanism of action? Their mechanism of action is neuraminidase inhibitors. They act by inhibiting the neuraminidase enzyme and blocks the viral release. So these are called neuraminidase inhibitors. What are those? Oseltamivir and zanamivir. Okay, oseltamivir and zanamivir. Okay, Now we will discuss one more class, that is RNA polymerase inhibitors. RNA polymerase inhibitors. Okay. Can you tell me what is the example? Baloxavir. Baloxavir. It is baloxavir. Okay. It is baloxavir. See, these things you should remember the mechanism of action. How does the baloxavir acts? Baloxavir acts by inhibiting RNA polymerase. Now we will discuss about some hepatitis drugs, anti-hepatitis B drugs, hepatitis B drugs. Okay. So these are classified as specific, okay, non-specific. It can be classified like this so that it becomes easy. It's not like, sir, it should be done like that or it should be read like that. No, it makes easy. This type of classification makes you easy. Also, it is notified in the reference book also. So just follow this. Miscellaneous drugs. So what are the specific drugs for hepatitis B? First one is entecavir. Entecavir. Second one is edifovir. Guys, listen carefully. Please don't distract. Please listen carefully. Okay. First one is entecavir and edifovir. These are the specific drugs for hepatitis B. If someone asks you non-specific, non-specific means which are actually anti-HIV drugs, anti-HIV drugs used for hepatitis B treatment. Anti-HIV drugs which are used for hepatitis B. What are those? Those are tenofovir. Tenofovir is used for HIV? Yes. Lamivudine. Lamivudine is used for HIV? Of course it is used. Emtricitabine. Emtricitabine. Very, very important. Emtricitabine. Emtricitabine, it is the derivative of lamivudine. And remember one thing, emtricitabine, most of the clinicians make this mistake. This should not be given with lamivudine. This should not be given with lamivudine. Why? Because emtricitabine is nothing but it is the derivative of lamivudine itself. Then why you will give with lamivudine? There is no meaning in it. Emtricitabine is the derivative of lamivudine itself. So it should not be given with lamivudine. So that is the indication that you should remember here. Next, clavudine. Next, telbivudine. Telbivudine. Okay. Now, just 1 minute, please. Yes. Now, what are the miscellaneous drugs? When it comes to miscellaneous drugs, it is interferon alpha. Interferon alpha. Then oral ribavirin. Oral ribavirin. Then, what are the directing? If you ask me, what are the direct acting antivirals? Direct acting antivirals. What are the drug of choices? If you ask me, because they become the drug of choices. Paritapravir. What are those? I will write here. Paritapravir. Okay. What is a paritapravir? It is a protease inhibitor or a protease blocker. Next, sofosbuvir. What are those? Sofosbuvir. What is sofosbuvir? How does it act? It acts by NS5B blocker. NS5B blocking. NS, I will write it clearly. NS5B blocking. And finally, one more drug, that is velpatasvir. It's velpatasvir. And how does this drug acts? This drug acts by NS5AB blocker. NS5A, that's it. NS5A blocker. Okay, sofosbuvir is NS5B blocker, velpatasvir is NS5A blocker. These are the direct acting antivirals which are the actual drug of choices. Okay, now sorry, I forgot. I am thinking something else and I wrote this one. Sorry. These are actually drugs for hepatitis C. We will discuss miscellaneous. Wait, miscellaneous. I'm sorry, I forgot to tell you. Miscellaneous. Okay, miscellaneous drugs are actually interferon alpha. And it is used for short duration. Remember, it should be used for short duration. That is, you can take maximum for 48 hours only. And you can remember one thing for sure, it is the drug of choice in respiratory syncytial virus treatment. It is the drug, man, I totally messed it up. Wait. So maximum it should be given for 48 hours. I will tell next time. I will tell after some time what is the actual concept behind interferon alpha. Okay, so before that we will discuss something. We will discuss about respiratory syncytial virus. What is the treatment for respiratory syncytial virus? If you ask me drug of choice, it is inhalational ribavirin. Right. But if you ask me the prophylaxis, what is the drug of choice for? It's a drug of choice for treatment. But if you ask me the drug of choice for prophylaxis, then obviously it is palivizumab. If you ask me the treatment of respiratory syncytial virus, it is inhalational ribavirin. It is the drug of choice. But if you ask me the prophylaxis of respiratory syncytial virus, then palivizumab becomes the drug. Now, what about hepatitis C? We discussed about hepatitis B, but what about hepatitis C? Hepatitis C, the drugs are interferon alpha, then oral ribavirin. Then if you ask me direct acting antivirals, which are actually the drug of choice for the infection itself, it is paritaprevir. Doctors don't think otherwise, right? Actually, I was in some sort of thought, so that's why I just missed the track. Sorry. Sofosbuvir is a NS5B inhibitor, and one more thing is velpatasvir, which is NS5A inhibitor. Okay, these all are the hepatitis C drugs used for hepatitis C. Okay, with this we finished hepatitis drugs. Now we come for antiretroviral drugs, and I just want to ask you one thing: shall we continue or do we stop here? I think it would be sufficient that if we can stop here, right? It would be sufficient that if we can stop here, and we will continue tomorrow itself. Okay, I think a little bit of things are remained, not much, but still I don't want to continue this, right? Because I just want to stop here. Okay, we'll stop here. That would be sufficient. Okay, stop here. What is the time? It's 29 minutes. It's 20. Okay, just wait. Then we'll finish the retrovirals. Yeah, we'll finish the retrovirals. Okay, so we'll discuss something about antiretrovirals. We'll finish as fast as we can. Antiretrovirals. The first one is NRTIs, nucleoside reverse transcriptase inhibitors. What are the NRTIs? First one is zidovudine. What is the complication of zidovudine? Anemia. Why anemia occurs? Due to simple bone marrow suppression. Anemia mostly causes due to bone marrow suppressions if there is any drug side effects. Next one is lamivudine. These all are NRTIs, nucleoside reverse transcriptase inhibitors. Next one is emtricitabine. Right? What do emtricitabine causes? Pigmentation of palms and soles. Very, very important MCQ. Pigmentation of palms and soles. Right? Next one is tenofovir. Tenofovir has some multiple side effects, like it has a it can cause nephrotoxicity, and if you take the safety profile of this drug is unknown in individuals whose age is less than 40, less than 10 years. Its safety profile is unknown, and if the people weighs less than 30 kgs, in that type of people also the safety profile is unknown. So in that case you can use abacavir as the drug. Abacavir can be used in these type of individuals, right, where the safety profile is tenofovir is unknown. And if you ask me, what about abacavir, sir? Do abacavir has any side effects? Of course it has. It can cause one of the serious side effects called Stevenson-Johnson syndrome. Very important MCQ. Now I just want to tell you one thing here, that lamivudine, emtricitabine and tenofovir. Wait, I will just mark it up. Lamivudine, emtricitabine and tenofovir, they are actually least toxic and preferred drugs. You may think like, sir, tenofovir, we don't know the safety profile, so instead of that we can use abacavir. Of course, yes, in case of individuals whom the safety profile of tenofovir is not known, you can go for abacavir, but still abacavir also has side effect, that is, it can cause Stevens-Johnson syndrome. So while comparing all these things, lamivudine, emtricitabine, tenofovir has least toxic states, they cause least toxicity, and they are the preferred drugs. Right, you got it? Yes. Now if you come to NNRTIs, non-nucleoside reverse transcriptase inhibitors, right? The first one is nevirapine. Wait a second. The first one is nevirapine, right? Guys, write this one. From this point, each and every drug and every statement is important. Now, nevirapine is the drug of choice which is used to prevent perinatal HIV transmission. I think if you just go to another subject, that is SPM, in SPM also neonatal transmission of HIV topic will be there. In that also you will discuss about nevirapine for sure, the doses, the route of administration and the protocol, how you should use nevirapine. Nevirapine is taken as syrup in case of neonates, right? So nevirapine is used to prevent perinatal HIV transmission. It is taken as syrup. Now you can also use zidovudine. What is zidovudine? Zidovudine is a NRTI. You please write it in the bracket. You repeat, you revise as many number of times as you can. See, the easy way to remember something in case of pharmacology. Why? Because in pharmacology, most of you, even me also, even I just simply forget each and every drug. Just right now, few minutes back, see, I have written anti-hepatitis C drugs in columns of hepatitis B. Even I forget. Even I make mistakes. Yes, I make mistakes. I am a human being. Yes, I make mistakes. So the only thing that you can do is, whenever you are talking about a topic, try to recall as much as you can about that particular. For example, nevirapine. You got nevirapine. So you only wrote the statement, drug of choice to prevent perinatal HIV transmission. But besides that, you try to recall each and everything you know about nevirapine. What you will recall? Yes, nevirapine is a NNRTI. Even though I did not write here, but still I know that it is NNRTI, non-nucleoside reverse transcriptase inhibitors, and nevirapine is given in the syrup form. Nevirapine is given in the syrup form. And if nevirapine, instead of nevirapine, can we give any other drug to prevent perinatal HIV transmission? Yes, we can give zidovudine also. And what is zidovudine? Zidovudine is a NRTI. So if you recall like this, if you try to recall just in a casual way, just like you recall, how you recall what movies did Pooja Hegde do, what are the hits of Pooja Hegde, what are the flops of Pooja Hegde, what movies did Samantha do, what movies did Samantha collab with Pooja Hegde. Just like you recall all those unnecessary things, when trying to read the pharmacology, you just read like this. You just try to recall as much information as you can about the topic. Okay, so you come to zidovudine and you just know the side effects that they cause. That is, they cause hepatotoxicity, that is toxic to liver, and they they also cause some rash, but this is not important. Hepatotoxicity is important. They cause hepatotoxicity, right? Until here it's okay. Now we will go for the entry inhibitors, right? We go for the entry inhibitors. Okay, so CD4 inhibitor, GP120 inhibitor, CCR5 inhibitor, and the last one, wait, I just forgot. Yes, GP41. It's GP41 inhibitor. Okay, CD4 inhibitor is, I will write with red pen, ibalizumab, and it's given IV. It is active against HIV1. Okay, and GP120 inhibitor is fostemsavir. It is active against HIV1. Next, CCR5 inhibitor is maraviroc, and it is active against HIV1 and 2. Enfuvirtide, it is given subcutaneous, and it is a fusion inhibitor. It's a fusion inhibitor. Now remember one thing, guys, all antiretroviral drugs are given by oral route. Okay, all antiretroviral drugs are given by oral route, except ibalizumab and enfuvirtide. These two are given. Ibalizumab is given IV, enfuvirtide is given subcutaneous. Remember this, very important MCQ. Now coming to integrase inhibitors. Right? What are the integrase inhibitors that we should read? That is, first one is raltegravir, right? And the second one is dolutegravir. These are the integrase inhibitors. Now we will read something about post-exposure prophylaxis. No, you don't need more than that. But it's still, if you want to read about it, you get to the reference textbook, that is Goodman and Gilman. You can go on with it. In that you have all sort of these mechanisms, all sort of these complications. You can read about raltegravir and dolutegravir. But I think for 2024 session, you take INACT or NEET PG. More than this, I think it's not necessary. It's enough. But if you want to go beyond that, I'm very much happy to say that you go and refer Goodman-Gilman's the recent edition. Okay. Now, what about post-exposure prophylaxis? Post-exposure prophylaxis, you gave, what is the protocol for it? You just give 2 NRTIs plus 1 miscellaneous drug. This is used in combination. Now, what is the preferred regimen in India? This is the MCQ. What is the preferred regimen in India? If you ask me, what is the preferred regimen in India? It is tenofovir plus lamivudine plus dolutegravir. That is shortcut, you call it TLD. Tenofovir, lamivudine, dolutegravir, which is the preferred regimen in India for post-exposure prophylaxis of HIV. You got me there? You got me completely? Yes. Now we will discuss about protease inhibitors. Buddies, I think don't think like I am exhausted, but I am exhausted. Protease inhibitors. Generally, protease inhibitors, they are metabolized by cytochrome P3A4. Why this should be memorized? This should be memorized. Why? Because if you give a drug which acts on cytochrome P3A4, then what happens? If the drug which you give causes inhibition of action of cytochrome P3A4 enzyme, then it causes protease inhibitor drugs toxicity. But if you give a drug which increases the action of cytochrome P3A4, then it leads to failure of protease 3A4. The primary basics, man, the primary basics, doctors, previously the first chapter which we read, it's in that chapter I already explained, no, cytochrome P3A4 enzyme inhibitors, all these things I will just know, I will explain, right? So why are you putting a question mark face? I already explained. So protease inhibitors, these are metabolized by cytochrome P3A4. Okay, that's the first important thing, remember. But there is a little bit exception. What is that exception? It is nelfinavir. Why? Nelfinavir is metabolized by which? Cytochrome P2C19. Nelfinavir is metabolized by this enzyme, cytochrome P2C19. Now, I just want to say one thing. What are the side effects of protease inhibitors? What are the side effects of protease inhibitors? Dyslipidemia, hyperglycemia, lipodystrophy, okay, lipodystrophy. Now, if you ask me what are some protease inhibitors, I will just simply say lopinavir, next ritonavir. Now we should discuss some important points about ritonavir. Ritonavir is the most potent enzyme inhibitor. Ritonavir is the most potent enzyme inhibitors. And if you talk about atazanavir, which is also a protease inhibitor, atazanavir is the drug which do not cause dyslipidemia. Remember this. So atazanavir can be given safely in people suffering with cholesterol issues, total body cholesterol issues, or lipid or abnormal lipid profile. people with abnormal lipid profile can be given with atazanavir because it does not cause dyslipidemia. And there is one more protease inhibitor which is important, that is indinavir. Indinavir, its one important side effect is it causes renal stones. This is important, man, and this can be a MCQ, but it comes as a clinical question. Okay. And if anything, I think I just want to say one thing. See, there is a drug called cobicistat, which is a cytochrome P3A4 inhibitor actually, and it is given in combination with atazanavir or dasunavir or elvitegravir. Just remember this point. Okay. Atazanavir, dasunavir and elvitegravir. I think it's okay up to this. We'll stop here. The next section we'll continue rest of the things. Okay. Thank you very much for sparing your valuable time with me. We will meet in the next class. Till then, revise all the topics, study as much as you can, study as many times as you can. Bye. Thank you. Take care. Yours lovingly, your wise doctor. Thank you.